Hello, I'm Miss Thomas, and thank you for meeting with us today. I am Taylor's teacher, and we also have his teacher assistant and speech therapist as a part of his team. I want you to know that you are one of the most important members of this team because you know Taylor better than anyone. Today, I would like to share Taylor's strengths, review his assessment information, discuss his goals, and talk about strategies we can use at school and at home. I also want to make sure you have time to share your concerns and ask questions. I want to begin with Taylor's strengths. Taylor is an active and loving child who enjoys cars, balls, music, noisy toys, and movement activities. He enjoys being around familiar adults and children. He can imitate actions, play near other children, seek adult help, and share humor with others. I have learned from working with preschool children that they usually learn best when activities are connected to something they enjoy. We can use Taylor's love of cars, balls, and movement to help him practice communication and taking turns. Taylor's assessment results show that communication is the area where he needs the most support. His ASQ3 communication score was 15, and his Vineland 3 communication score was 45. These scores tell us that he is having difficulty expressing his wants, needs, and feelings. Taylor does use gestures, some words, and other ways to communicate. He can also follow some simple directions. However, when he cannot communicate what he wants, he may become frustrated. During play, he may pull, grab, or push when he wants a toy or does not know how to join another child. We do not look at the test scores alone. We also use classroom observations, family input, work samples, and information from his speech therapist. All of this information helps us see the whole child. Taylor's first long-term goal is to communicate his wants and needs by using a word gesture, picture, sound, or another method in out of 5 opportunities. His second goal is to share, take turns, request toys, and join play without pulling, grabbing, or pushing in 4 out of 5 opportunities with other children. At school, we will use picture cards, visual schedules, simple directions, modeling, and wait time. For example, when Taylor wants a car, I may model the word car or show him a picture of the car. I will give him time to point, gesture, make a sound, or use a word. I will praise his attempts so he learns that communication works. We will also practice taking turns with toys he enjoys. I may use cards that say, my turn and your turn. But first, I will show him what to do. Next, we will practice together. Then, I will give him the chance to try it more independently by himself. A strategy you can use at home is offering Taylor 2 simple choices. For example, you can show him juice and milk and ask which one he wants. You can accept a point, gesture, sound, picture, or word as a communication. You can also practice words such as more, help, stop, and all done. Please give him a few seconds to answer because some children need extra time to process what was said. This is something I use in my classroom with preschool children, especially children with speech delays or other developmental needs. I would like to hear from you. What words, sounds, or gestures does Taylor use at home? What does he enjoy doing with your family? Are there any strategies that work well when he becomes frustrated at home? Thank you for sharing your information. We want to make sure our plans respect your family's routines, values, and priorities. We will continue communicating with you and sharing Taylor's progress. To summarize, Taylor has many strengths and enjoys interacting with others. We will focus on helping him communicate his needs and interact safely with his peers. We will monitor his progress through observation and data collected during regular classroom activities. We will review the plan and make changes when necessary. Thank you again for meeting with us, and for working with us to support Taylor.